Hi, it's Dr. Casoni. Today we're going to talk about the 5 functional causes for chronic headache. Cause number 1 is going to be blood flow. So, poor blood flow is an interesting concept in the body because your average cardiologist isn't even going to look at that, right? Cardiology is all about the study of the heart. And of course, we refer out when there's very serious risk factors to make sure that there's not a heart problem. But there's subclinical effects where blood is not moving the way it should through the body. We can see that with such symptoms as the blurry vision, the heart palpitations, the hair loss because the microvascular pathways, even erectile quality is related to blood flow. These are patterns of blood flow. Irregular patterns in the menstrual cycle, including a crampy period, those are all going to be problems with blood flow that your cardiovascular specialist won't even look at because they're subclinical, but nonetheless, they are patterns that can affect the body and cause symptoms. Now, in the head, if there's a poor blood movement, the result will be pain. Blood not moving in the arm, you may not notice it. If it's in your joint, you might feel joint pain, but if it's in the head, you're going to have a headache or a migraine. So the treatment strategy is to be moving the blood. And with plant medicines and with other modalities, even could be exercise, could be acupuncture, we're increasing the blood flow throughout the body and we see correction to that chronic symptom. The second cause is going to be the liver. And interesting enough, the liver affects the first one, which is blood flow. If there's a congested liver, you're going to have poor blood flow, which can cause the headaches or migraines, can also cause the problems with blurry vision, as we mentioned, and even menstrual irregularities. You got to know your signs and symptoms so you can figure out where the starting point is in a given case. If you're going to do functional medicine, you got to know your physiology. There's a lot of functional medicine doctors out there that are doing all these elaborate tests, including genetics tests, and they took the weekend course by the testing company and the nutritional company because they're in bed together. And so now instead of doing lots of labs that are selling drugs, now they're doing number vitamin, and it just doesn't work that way. People take all these supplements and they're really not getting better because they're treating a number without understanding the nuance of the presentation of the patient in front of them. So you have to know what signs and symptoms are related to that organ system. Remember, there's a million diseases, but there's only about 10 systems. So we don't want the natural thing for headache. We want to treat the cause of the headache, right? What system is in trouble, what's in the way of function, and then how to improve the function of that system. So if the liver is involved, we're going to see some other signs and symptoms that we have that congested liver, but one of the main ones would be headache, and it would be impairment of blood movement because that congested liver. Number 3 is going to be the adrenal glands. The adrenal glands in the body are a powerhouse system. They produce close to 24 different hormones. Well, one of those hormones is norepinephrine, and it's in charge of vasoconstricting and vasodilating the blood vessels. So the blood vessels are wrapped with muscle and they're always in a semi-contracted state. They never just let go because what would happen is they would expand too much and the blood pressure would drop. In fact, that's kind of what happens sometimes in the movies where you see somebody in shock. There's a few different types of shocks, but this one is referenced typically to some sort of accident. The adrenal glands kind of go super excited and then they crash. So it's like a spike and drop. That drop in adrenal gland function has the person's blood vessels drop a little bit. They sag too much. They go into low blood volume. So hypovolemic shock. They actually drop their blood pressure, which can kill somebody if they're not careful. But nonetheless, regarding headaches, the adrenal glands are keeping the blood vessels in a semi-tonic state. They're slightly contracted. And then if you have something stressful or you're going to run from a bear that's chasing you, the adrenal glands will vasoconstrict and tighten those vessels so you can deliver more nutrients to the muscle and fuel and run from that creature that's going to chase you down. However, here we are stressed out. We're kind of drinking too much coffee and stimulating the adrenal glands. We're stressed out with our job, our kids. And so the adrenals are a little bit crispy anyways. And so now they're starting to underproduce some of those hormones. And if they underproduce hormones like norepinephrine, then what you're going to have is a little bit of a sag to that blood vessel in the brain. Now, if it's not being constricted the way it should be, and it's loosening up, a little bit of dilation, the size is bigger. That bigger blood vessel, especially if combined with some of the blood stasis from vascular issues or from the liver or from spike protein exposure, like you've seen me talk about, well, then we're going to have a vessel that's a little bit too big. We're going to have a headache or a migraine. And that would be the person who does notice a slight improvement with their headache when they have a little bit of caffeine or a stimulant, because it's kicking those adrenals into gear for a short amount of time. So it's not even relief for very long, but at least we can see that adrenal gland involvement. The stimulant is kicking the adrenal gland back into the gear. It's producing the norepinephrine for a moment before it kind of piddles out again, and then they got their headache. The fourth main cause of headaches, functionally speaking, is going to be blood sugar instability. If the blood sugars are not stable, meaning that you're moving from sugar usage to fat usage within the body to create a stability, what we call blood glucose stability should probably be called blood glucose lipid stability. But nonetheless, if you're stable, you don't have cravings, you're really not gaining weight, and you're sleeping great. But if it's kind of wonky and it's like a spike and drop, you're getting tired after you're eating, you're starting to crave more sweets or carbs, you're starting to get to where you're irritable if you haven't eaten. All of these things mean that you're not really burning fat the way you should, which is very stable, and you're kind of having peaks and valleys to that blood sugar stability. Well, that will definitely cause headaches. And the mechanism there is both involving the liver and the adrenals, because every time you crash, not only are you going to crave carbs or fuel to get back up, but you're also going to trigger the adrenal glands to produce other hormones like cortisol that are going to go to the liver and make the liver make sugar. That pathway is called gluconeogenesis or glycogenolysis. Those pathways are freeing up sugar because you're crashing and you're not burning fat the way you should, and sugar is very volatile. So it's trying to compensate, but while you're making the liver produce sugar, it's starting to bind up its filtration mechanism, right? So filtration is a way to think of the liver, but really it's adding enzymes and neutralizing harmful agents. But if that is impaired because it's trying to produce sugar to get you through the day or through the night, then you're going to have a congested liver, which is going to contribute to that chronic headache. The final cause of headache that I want to mention, or chronic migraine, would be tension of the upper back muscles or neck muscles. Now, this is kind of interesting because this still can involve some of the earlier causes. For example, if blood is not moving very well, your muscles are going to be tight. They're not going to be supple. Think of exercise and movement and stretching. All of that is just moving the blood, which is going to decrease tension. But if you're sedentary, which is also making blood flow worse, or if there's something else that's chronically causing blood flow movement problems, then you're going to be prone to tension in the muscles. You're going to be prone to even joint pain, right? Joint pain is a number of things causing inflammation, but it's typically at least localized blood flow impairment so that we're not getting nutrients in to repair the joint and we're not removing waste and it's getting inflamed. So in the tension of the muscles, same thing is involved. Why are we stuck being tension? Okay, could be lifestyle, could be at a computer all day, but could also be that there's some systemic blood flow issues. And then when we look at the adrenal gland involvement, it's as if we're really looking at a few of the same players here, but the adrenal glands are also producing sex hormones. So depending on the age of the person, that could be a factor to consider. The younger the person is, their gonads, which would refer to the ovaries in the females and the testes in the male, are producing sex hormones that also keep the muscles, tendons, and ligaments supple and elastic and flexible. However, after late 30s, both sexes are starting to rely more on the adrenal glands to produce sex hormones. So if they're stressing out their adrenal glands from either the blood sugar handling problem or their stressful day or high consumption of coffee, they're going to have a decline in sex hormone production. That's going to be accompanied with other signs and symptoms that we have to know. Could be low energy, could be low sex drive, could be a few of those things, but we're going to see tightening of the muscles, tendons, and ligaments, and that's going to contribute to these pain syndromes, tension, and now we have that full cascade resulting in our chronic headaches and migraines. Now, how do you treat these dilemmas? Sometimes it's going to be lifestyle. Sometimes it's going to be some dietary change, especially if there's a blood sugar instability. We're going to lower the carbohydrates. On our website, we have the Reset Food Plan, which is a program you can access at no cost. So try that out. Start that out at right away if you have chronic headaches. But better is that we have to get some functional assessment. So come see me so we can identify what areas are the problem areas. Of course, there can be other areas additionally to these 5 main themes, but these are the themes that I've seen over and over again for many years. And that way we can come up with an accurate diagnosis and start treating with a customized plant medicine formula or nutritional supplements if we need to. When you're doing it right, you're treating that root cause. We're getting you better, and then we can decrease what you're on because we're fixing that root cause. Thank you for watching, and I'll see you next time.